So we welcome Dr. Basu.
Thank you. Thanks, Melanie. Let me first begin by thanking the IOM and the NSF for inviting me to participate in the workshop and in the committee, and also presenting at the workshop. We were given some topics about speaking about standards in CBA. I come from the world that I'm mostly involved with cost effectiveness analysis. Also, we debate about CBA all the time because in the cost effectiveness world, there is this debate about what the social welfare function should be. And obviously, CBA sidesteps that and kind of says that we know what the social welfare function, this is how we're going to do it. And cost effectiveness analysis kind of does the same thing, but then they continuously struggle with the fact that what kind of social welfare function that we need to maximize in order to kind of do these analysis. But today, what I'm going to talk about is this expressions of uncertainty in evaluations, whether it's in CEA or CBA, and it seems that there are some standardization or consensus around standards about how to express uncertainty in these evaluations. And I'm going to talk about some of these aspects that have been developed or been used in the CEA field, but also would be, I think, relevant for the CBA standards. I think yesterday we discussed the importance of expressing uncertainty, and I think the issue is best summarized by this paper by Chakmansky, who some of you may know is a very well-known economist at Northwestern, and this paper on policy analysis with incredible certitude. And let me just read out the first paragraph, which I think makes it so relevant for our discussions. Is that it says, analysis of public policy regularly express certitude about the consequences of alternate policy choices. Point predictions are common, and expressions of uncertainty are rare. Yet policy predictions are often fragile. Conclusions may rest on critical, unsupported assumptions or on leaps of logic. Then the certitude of policy analysis is not credible. And this is a very important topic in the sense that most CBA and actually at some point most CA analysis also used to report results that are that were just point estimates. Even I can point out, even last few years there have been reports of results that have reported point estimates without expressing anything about uncertainty about those point estimates. And the concern then is that one of the reasons that they are reporting point estimates is because decision maker do not care about uncertainty. Although there is no empirical evidence to show the decision maker doesn't care about uncertainty. This is kind of a thing that's taken as given. Although as Steve Wall showed that one of the unique cases where he does present uncertainty to decision makers, and it'd be interesting to see what the consequences of those presentations are. So the question is why we need to account for uncertainty, and again, Chakmansky kind of puts forward this simple construct where the way we do empirical evaluations is that we take data and we add assumptions to it and we arrive at conclusions. And the reason we need assumptions is because we do not know the true production function for the data. If you knew the true production function, then we do not need assumptions. We could just tweak the production function and see what would the data have been under different intervention, and our conclusion would have been very precise and credible, and with incredible certitude. And as you can see, the stronger the assumption, the less the credibility, and yet stronger the conclusion. And obviously, there's a famous quote by President Lyndon Johnson, the ranges are for cattle, and give me a number. And so that has been used for actually reporting numbers and not uncertainty around numbers for many cases. But the point about uncertainty is that even if somebody, a decision maker, truly wants a number, that I really do not care about the uncertainty, the outcome, give me the best number from this intervention, even then, uncertainty becomes important. And it becomes important because the production function, the inherent production function that we think about that produces data is often not linear. It's a nonlinear function of different inputs and parameters that produces the data. And once you have a nonlinear function, the expectation of that function is not equal to the function of the expectation. It's kind of a classic Jensen's equality. So if you input a specific value, only the point estimates of numbers in your model, and generate an outcome, it will give you a very different result, a point estimate, rather than when you actually understand the stochastic or the uncertainty around all your inputs in that production function. So another way to look at production function is to understand that production function of any data is inherently heterogeneous. So one could think about that, this production function is deterministic, and it's driven by some sort of inputs that determine all variations in data. But among those heterogeneous production functions, there is scientifically known heterogeneity, like we know age affects something or race affects something, or we know that there are certain differences in gender that has been scientifically proven. And there is a scientifically unknown heterogeneity, where we know this variation exists, we have no idea how to explain this variation, which is, according to the Rumsfeld quote, it's the unknown part of the model. Obviously, the scientifically known heterogeneity could be divided into heterogeneity that's directly observed to the decision maker. I mean, they can make a decision maybe on by gender or by age group, but it may remain unobserved to the decision maker. So we know that patient preferences matter in uptake, but we don't directly observe patient preferences. Now, there's a large literature that have exploited this second part, which is unobserved to decision maker, but observed to agents who are making the decision to deal with selection biases and methods with that. But in general, observed decision analysis have been grouped under heterogeneity, or observed heterogeneity, where you can make subgroup analysis where you have data. But these unobserved heterogeneity, which is unobserved to decision maker, but scientifically known, and the unobserved, completely unknown heterogeneity together forms all kinds of uncertainty in your model. It could be stochastic uncertainty, parameter uncertainty, structural uncertainty, and I'll go over each of them briefly. And as I discussed, it is important to express in some form, depending on what the questions are, some form of this uncertainty to decision makers to make better decisions. So we talked briefly about some of these uncertainty yesterday. Stochastic uncertainty is used to study random variation of individual outcomes. So a population of people have a probability of survival of 5%, but at the individual level, you either die or live. So there is some random stochastic uncertainty to it. And usually it's studied using microsimulation or first-order Monte Carlo techniques. Then there is parameter uncertainty. So your probability of survival it's 5% on average, but it could be 2% or 5 or 10%. And that's used to study variation in expected outcomes, which is of primary concern maybe to decision makers, many decision makers. And those are studied with probabilistic approaches, especially second-order Monte Carlo simulations. And then there is this world of understanding structural or model uncertainty, because you are imposing a model to the real-life data. And as Box said, all models are wrong, some are useful. And so you have to kind of understand if there is something that comes up a model uncertainty that should be expressed. It's used to study both variation in expected outcomes and individual level outcomes, but there's no clear consensus on how to study such uncertainty. In many cases, often people do sensitivity analysis, just run two different models and see how things are moving. One classic example are the National Cancer Institute funded the CISNET model to model cancer progression, but there are no one model for the same type of cancer, and so they have funded different centers around the country, and they actually analyze the same problem using different models, so that they come together and they compare their models and see why they're different and why they're similar. There's this work on model averaging, although there's a lot of controversies around that. In most cases, people have tried to parameterize the model uncertainty problem, so have expressed model uncertainty in a parameter in the model, and then have applied methods of parameter uncertainty to it. So So what this leads to, and especially the part which deals with uncertainty in expected outcomes, is this idea of decision uncertainty. So if you have parameter uncertainty, if you have model uncertainty, what it would lead to is decision uncertainty, where you have unexplained variation in expected outcomes that leads to this decision uncertainty. And at least the CEL literature have kind of reached consensus that there is important to express decision uncertainty, and there are alternative ways to express this decision uncertainty. It really depends on the decision maker, what they want to know. And there are three ways that I say here. One is saying the 95% confidence interval on benefit-cost ratio, and the cost-effectiveness ratios or in the CEF field, 95% confidence interval for net monetary benefits, and this concept of acceptability curve, which is exactly similar what Stephen Oz does in terms of representing uncertainty in his cases. So just briefly about how these uncertainties are expressed. In cost-effectiveness literature, you have these, if you're comparing two interventions, you have these incremental, say, QALYs or benefits on one x-axis and incremental cost on y-axis. And here's a Monte Carlo distribution of the mean expected cost and expected benefits, or incremental expected cost and incremental benefits. And then the 95% confidence interval are just two lines from the slope, which is the ratio of cost to benefits that would eliminate 2.5% of the cloud on each direction. And what this width tells us is that it's very similar to traditional interpretation, is if the maximum willingness to pay for each unit of benefit is included in that confidence interval, that we cannot be confident, at least at the 95% level, that truth therapies differ in cost effectiveness analysis or in their cost effectiveness. If it's excluded, if it's outside, then we can be 95% sure that it's included. So in this case, if the maximum willingness to pay or the slope was here, then we would be 95% sure that this new technology is a good value. But if it's within, then we are not so sure. Similarly, one could express it as a net monetary benefit approach, where you have, you multiply the willingness benefits with the willingness to pay and subtract costs, and then you just do a standard confidence interval for the net monetary benefit. And this net monetary benefit changes with your level of willingness to pay, and you would see at this level you have the entire width below zero, which means this new technology is not cost effective, whereas at this willingness to pay, the entire width is above zero, which is the new technology is cost effective. And lastly, this concept of acceptability curve, which is very simple, is that it says that you take the same cloud that we saw before, and it said, give me one willingness to pay, and with given any willingness to pay, what fraction of the cloud falls below the threshold. So as you change, as you are willing to pay more and more for each unit of benefit, you cover more of the cloud below, and so your probability of acceptance of this new technology goes up. So that could be represented in this figure, where as you change willingness to pay, the probability of accepting new technology increases. It turns out that each of those methods give you the exact same information about uncertainty in cost-benefit analysis or cost-effectiveness analysis. And it really depends that, what you feel comfortable in expressing, what the decision maker feels comfortable in kind of understanding, how to understand heterogeneity. There is a movement towards this acceptability curve, which is in line with what Steve Oz group is presenting in terms of uncertainty, for not only its simplicity, that you can actually see that if my willingness to pay is so much, I'm only 50% certain that this new technology is cost effective. The last point I want to make is that another advantage of acceptability curve or these probability is really about decision making for future research. And the acceptability curves links directly to the value of future research. There's a concept called expected value of perfect information, and which says that whatever policy decisions I make today, there is a risk that I take in making the decision. Right? And the risk is because my policy decision is not the optimal policy decision. And it's not the optimal decision because I have uncertainty in my decision. And so the expected value of perfect information, so if I had suddenly all my decision uncertainty was resolved, could be expressed by this simple formula that what is the probability that the decision today with current evidence is wrong, and what is the loss due to this wrong decision. Right? So this simple product gives you an upper bound on the value of future research. So how much are you willing to pay to resolve your decision uncertainty about this problem? And this idea, this value of information methods, could be used to inform many other decisions, whether to fund future research, how to prioritize across future research proposals, whether to target interventions, and how to design future research studies. I mean, yesterday there was a discussion about what happens if you have 20 years of follow-up, and much of the study designs that actually need 20 years of follow-up is trying to get to the incremental cost-benefit effects very precisely, the true incremental cost-benefit effects. But maybe you do not need to wait 20 years if the sufficient information to change your decision arrives at the 5-year mark, right? So the information that's sufficient to change your decision could be arrived at much earlier time, and these kind of methods can help decide across alternative designs to do your analysis. This is a very active and growing field in cost-effectiveness analysis. In fact, the Patient-Centered Outcomes Research Institute that was created by Affordable Care Act actually specifically asked for prioritization, and this is one of the methods that have been discussed in doing that. So I think hopefully some of these methods and future directions could also find some synergies and kind of mirror to the CBA field. I think that's all I have. Thank you.
Thank you very much, Dr. Basu. All right, and our third speaker will be Dr. Lynn Caroley. Dr. Caroley is a RAND senior economist with expertise in child and family well-being, human capital investments, social welfare policy, and labor market behavior. Much of her current research is focused on early childhood programs. She recently completed a multifaceted study of preschool education in California that addresses school readiness and achievement gaps, the use and quality of early care and education programs, the system of publicly subsidized ECE programs, and professional development for the ECE workforce. Other recent research has focused on ECE quality rating and improvement systems and the use of ECE programs by immigrant children. In related work, she has examined the costs, benefits, and economic returns of early childhood interventions and youth development programs, and she has assessed the use of benefit cost analysis more generally to evaluate social programs. Other recent research focuses include the effects of welfare reform policies of the 1990s on family and child well-being and the future of the workforce and workplace in the United States. In addition to her research, Dr. Caroley currently serves as an associate editor for the Journal of Benefit Cost Analysis and previously served as co-editor for the Journal of Human Resources. Dr. Caroley received her PhD in economics from Yale University, and Dr. Caroley is also a member of the Planning Committee. Welcome, Dr. Caroley.